What's up, guys? I am driving to work right now. We're going to take you through our protocol of what we're doing for this COVID-19, how to manage the office and the patients coming through. So hang tight. I am just pulling up, and so I'm here at our office. Come Monday, we'll be seeing patients. I want us to make sure that we are gloved, masked, prepped. What we're gonna do is actually, here at the office, we're gonna have the patients call. So let me call Crystal, or Ho Rehab Center. We're gonna call Crystal to see if we're ready to come up. So let's give her a call. Call in Ho Rehab.
Rehab, this is Crystal.
Hi, Crystal. I have an appointment. I'm ready to come in. Is everything set for me to come in?
Go ahead and come on up in about 2 minutes.
Okay. Perfect.
Thank you.
Sounds good. See you in a little bit. Bye.
Bye.
So there you have it. 2 minutes. We're waiting 2 minutes, and then we're gonna head on up. So we're coming in through the office now for our patients. Remind them, hey, these are all contaminated possibly, so keep your hands to yourselves. We also have chairs outside. 1, 2, and 3. If the patient does not want to wait in the car, they have the option of also waiting up here. Or if they forget to wait in the car, they come up here. We're gonna put them out here before, so that they're spaced out 6 feet from each other. These need to be cleaned every single hour or after a patient uses it. So, person who's on cleaning duty comes out here, wipes it down really quick, takes care of it. We're gonna get our temperature checked. So, we're gonna lean over. Crystal's gonna check it. Is it appropriate? She's not gonna say anything. I'm gonna sign in here. All right, I'm gonna give this back. I'm gonna take out my payment, slide it over, step back. She collects the payment, gives it back to me, goes back in my pocket, and the aide or the therapist will come to the door and take the patient directly into the room. So, what room are we taking?
Room 2.
Let's go to room 2. Now that we're in room 2, let's take a look at a few things here, okay? So, this whole room is now the patient's room. So, the patients are gonna be in here the entire time. What we're gonna do is, after the treatment, we're gonna wipe down everything. So everything means everything. All this, especially the doorknob. If we decide to close the door or leave the door open, the doorknob needs to be wiped down. All the common touching areas. So possibly this, all the electrical stem and the chair. All right. Anything that the patient also sets their purse on, their items on. So anything that you can think of, wipe it down. For the patients that use stimulation for pain management, there should be electrodes in their chart if they've purchased the electrodes. If they have not purchased the electrodes, go ahead and let Crystal know, or the front office know, so that they can collect the payment for the electrodes. All right. Right now, on the electrodes, there's nothing. There shouldn't be anything on the electrodes. So if the patient needs it, then they need to purchase it. It's $6. For exercises and all the equipment that you're gonna be using for the patient, go ahead, the therapist or the aide will go, that's working with the patient, go ahead, go out to the gym, grab the item and bring it back here, all right? The gym, we're only gonna have 3 to 4 people at the gym max, keeping a 6 feet distance, all right? 4 corners of the room. Each room will have a checklist, all right? A laminated checklist. So when you look at the checklist, because you can see what you need to do, all right? Wipe down top of the bed, bolster, stool, doorknobs, everything. Every single thing. So you can go through, check it off, and that way we know that this room is done. So now let's go out to the gym. If we bring a patient out to the gym or we're working out in the gym, let's go. So now that we're in the gym, we also want to make sure that we're 6 feet away from everybody. So one person will be here, one person will be there, corner, and here, all right? We're trying to limit as many patients out here as possible, so try to do all the exercises in the room. If we were to use, let's say, the new step, all right? Here's the new step. If we're using the new step, make sure that we're wiping down everything after the patient is done using it, okay? So now, all the exercises are done. The gym materials are all wiped down. The session is done. It's concluded. They gotta go. So, instead of coming down through here, we're gonna escort the patient down this hall, out that door. So we come here, open up, give him a little push, see you later. And that concludes our tutorial of patient care during COVID-19. See you later.